Over the last 3 years, we've been a patient and public group
associated with the National Institute for Health Research Career Development Award.
Many of us have been involved in health and social care research projects for many years.
We want to offer practical advice for you to consider as you work with patients and members of the public in research you undertake.
It's important for any member of the public who gets involved to feel valued, and the way they must feel valued is different, of course, depending on each individual's setting.
Not everybody can drive or find it easy to get to where your meetings and studies might be. It's important to not make any assumptions about the people that you're going to be working with. Their backgrounds, their knowledge.
The old adage, don't judge a book by its cover. Some of us may have been CEOs of companies, some of us could have been road sweepers. Treat us as you would like to be treated and you'll get the best from us.
Having patients at a pre-formative stage of discussion, when you're generating ideas about how to work the questions, it will help with your application to show that you involved people with lived experience and provide their narrative and perspective.
If researchers want to reach groups that are hard to reach, then they need to get somebody from that community and use that as a launching pad to be able to get them involved in their research.
Diversity is vital. The country is very diverse. We have to make sure that everybody has a voice.
Lots of different backgrounds it's important to have so that when the research is done, it can be applied to all those different backgrounds.
We work together maybe for 3 or 4 years on a particular research study, so it's great to feel that we're all working towards the sort of same common goal.
I think they just need to be empathetic towards you because sometimes you're coming from a place maybe where you've had the illness and you've not been in perhaps a good place at some point in time.
The thing that I think is most important is to always provide feedback to your PPI members so they know that their input was actually important and valuable.
Participants should be reimbursed, especially for any expenses they outlay. The people sat opposite you are being paid for the role they are doing, so I think that the person who's sat in the hot seat being patient or carer should have some form of reimbursement.
We want to be involved because we care about research that affects patients.
That may affect us, our family and friends.
And we assure you do too.